Dr. Alan Dietzak back to the podium. Looking forward to hearing about ClosureFast study for your update. Al.
Thank you, Lowell. My disclosures. So I'm going to present to you the interim update for subjects returning at 4-year follow-up in the ClosureFast study. This is a multi-center prospective longitudinal single-arm matched pair study, the purpose of which was to evaluate the long-term outcomes with the ClosureFast catheter. Primary endpoints were vein occlusion rate and absence of reflux rate. Secondary endpoints, presence of complications and side effects from the saphenous intervention, and the status of clinical signs and symptoms of lower limb venous disease. 396 limbs were treated in 326 patients at the outset. 262 limbs in 201 patients were available for review at 4 years. And this is the ClosureFast occlusion rate at 4 years, 91.8%. And you can see that this is a little less than 2% decreased from last year. And you can predict from this model that a limb will develop reflux in approximately 2% of limbs within the next 12 months. The ClosureFast reflux-free rate at 4 years is 93.2%, again, about 2% less than it was last year, and the chances of developing reflux over the next 12 months is approximately 1%. Seat clinical class for these patients at the outset, 43% were seat class 3 and 4, 82% seat class 2 and 3. At 4 years, we see that 10% are now seat class 3 and 4, and 82% are seat class 1 and 2. Venous clinical severity scores at baseline were on median level of 4. And at 4 years, the median VCSS score is 0, and here are the ranges at the bottom. Procedure-related complications are very infrequent. At 4 years, we see that there's one limb that has paresthesias during the entire 4 years of the study, and there was one limb at 3 years that had phlebitis as the result of sclerotherapy treatment. That has since resolved, and there are no new procedure-related complications. We looked at anatomical failures in this patient population. There were 27, 4 recanalizations, and 23 limbs with reflux. And we looked at possible predictors of these anatomical failures. We looked at baseline D2 diameter, the diameter 3 centimeters distal to the